seeing patients and making your notes is doing it as you walk around, you can certainly use one of these and do it. I've done it. But it's just different ways of approaching it. So basically, I start up Commander on my laptop. I start Lorenzo. I open a note, and I'll show you all these in a second. These are just the steps that I go through. So I dictate my note. I proofread it. I complete and print it. And because I'm the only one that's doing it, I staple it into the CAS card. So I print a hard copy of it right directly from Lorenzo. So it's in the EPR of the patient, and it'll be there forever. But I also print it just because at the moment, we're still using the paper notes as our primary clinical data repository. So there's a copy of the note stapled into their CAS card. So if they come back the next day and I'm not there, somebody can read my note and see what they've said. And I also send that note then when they get admitted. A copy of that note goes with the patient. So the registrar or whoever for medicine or surgery is then able to have a copy of what I've said, and they can read it. So this is Lorenzo, if you haven't seen it. So basically, this is a patient screen. This is Ward 10. These are all our fictitious patients, all our test patients that we do. Ward 10 is the informatics ward. That's where we're based at in Barrow and Furnace. So you click on the patient there, as you see with the red arrow, and then then you go to the, well, you can't really see it on this thing here. Let me just move this slightly. At any rate, on the side there's a tab that says Clinical Notes. And you click on the tab that says Clinical Notes, and that opens up the Clinical Note feature, okay? And then you click on Create Note. So I want to create a note. Then I pick the kind of note I want. I could either do, these are my favorites, so I could either do a discharge summary or I could do an emergency department note, okay? And so you just click in that box there, and then up comes TX text. So this is our word processor in Lorenzo, and basically this is a blank sheet of paper, okay? And so you could certainly type on a keyboard and type text in there, or you could do whatever you want. You could put headings in there, and I'm not going to go through a whole Lorenzo explanation here, but just suffice it to say it comes with a heading, it brings through the demographics and all that sort of stuff, so it helps you there for that standpoint. Then I dictate my note, and this is what it looks like at the very end. Okay, so this is what I print out. And so it's got a heading, it's got my note there, and it's got my electronic signature at the bottom. So this is the National Program's electronic signature, my name, my GMC number, my role, and when it was created. And if I went back in and modified it, it would have a modification date time stamp as well. Okay, and then once I'm finished with it, then here's the Clinical Note tab again, and you can see the note is there in the list of notes that they have available to this particular patient. You could preview that note if you wished, and that window that you just saw would come back up again, and you could see the note that I just dictated. Okay, so that's what I do in the emergency department. And voice recognition. Obviously, this is a picture of the Matterhorn. I was there skiing in March last year, but voice recognition is very similar to the Matterhorn, I thought, because it's a very steep climb till you get to the top, but when you get there, the view is fantastic, and you can really get, I think, a really great way of doing clinical documentation. So let me show you what I do. So the first thing you got to do is you got to turn the microphone on, and then we'll see how it works. Free text. Free text. Always fun when you try to demonstrate this stuff. Try one more time. Free text. Free text. There we go. 21-year-old white male complaining of left ankle injury, period. The patient states he hurt his ankle as he fell off a curb while drinking heavily, period. The patient is complaining of pain with weight bearing, comma, and denies any other injuries, period. The patient states he suffered the injury last evening, period. New paragraph. Past medical history is significant for hypertension, comma, angina, comma, and moderate alcohol use, period. New paragraph. Objective hyphen. Alert white male and no acute distress, period. New line. Get normal chest. Get normal heart. Extremities, hyphen, moderate swelling and tenderness is present to the left lateral malleolar area, period. Moderate ecchymosis is also present, period. The Achilles tendon is intact, period. New paragraph, assessment, hyphen, left ankle fracture. New paragraph, plan, hyphen, posterior back slab, comma, codeine, comma, fracture clinic in 2 days, comma, and non-weight bearing, period. New paragraph, my signature. Go to top, go to sleep. So that's it. Thank you very much. All right, okay. So that's the first step. Okay? Now you got to read through it. Now you got to correct it, make sure there are no errors in there, okay? And if there are errors, you fix them. So there's one error right there at the beginning. So let's so that wake up and go to sleep business was turning the microphone on and off. You can also do it on the keyboard, but it's easier just to do it with the voice command. Wake up. 21. Select left. Left ankle. Select the, her. He hurt. His. Go to sleep. Now, the other thing you notice, you might have heard me say get normal chest and get normal heart. That basically was a shortcut of text. Obviously, in an ankle injury, I probably wouldn't have listened to his heart and lungs. But it brought in a segment of text that is my personal normal chest exam and my personal normal heart exam. Basically, you type it out once, and basically it's like a canned statement. So it's easy to bring in, and you can certainly modify those if you wish during the dictation. Wake up, page down, confirm. Go to sleep. Okay, so there it is, inserted into a Word document. And obviously I got to just backspace out that little bit of stuff that wasn't relevant. And there's our note. So that gives you some idea of what it looks like. And this is what I do for all my notes in A&E. And, for me, it works pretty well, and it's easy enough to do. It's certainly much more complete than I would ever write. I'm sure any of you guys who have ever spent any time in A&E, it's a quick scribble of a note or two, and, and most of the time you can't read it anyway. But, it's whatever you say. I could certainly put in an ECG interpretation or CT evaluation or whatever, I sort of do much more complicated chest pains and abdominal pains and all that sort of stuff. So it just depends upon how much time you want to put to it and how comfortable you get with the software. Okay? So there's an example for you of what my impression of voice recognition I think is ready for prime time if you're willing to put the time in to learn it. So thank you very much. So I'd be happy to take any questions. Yes, sir.
Could you maybe tell me anything about the cost of such a software?
The cost of the software is it varies, okay, but for us, what we've been doing with a Talking Point, it's £675 per user, okay? Now that includes a headset or a speech mic, 2 half days of training, okay, and the user license and the vocabulary. But what that does is it really helps you train. It customizes your voice profile for you, helps you set up your phrases and all that sort of stuff. And it's basically, I think it's like £100 a year or something like that for the renewal. But it's a relatively inexpensive thing that you can use for many, many years, and you can take your voice profile with you if you went to another trust, say, that had the same software. So you don't lose it. Because once you create it, it's a lot of work to create your voice profile. Anybody else? No? Yes, sir. Or yes, ma'am. Sorry. Pardon me.
Hi. Obviously, in an emergency department, you tend to have less people contributing to care than you would, say, on a care of elderly ward, where you've got like dietitian, social worker, physiotherapist, and so on, and as well as the medical team. How would you get the multidisciplinary team to use it all together and apply it that way?
Well, there are some limitations with it, as I said, and basically one of the primary limitations is the voice profile. Okay, you can really only have it active on one PC at a time. And so if you have a multiple disciplinary team with several people, you're only going to have one person dictating at a time. Now, whether that be the AHP or the junior doctor who's doing the notes, or the consultant who's doing the ward round, it just depends. You can use it on a mobile device very easily, and so potentially you could have 2 or 3 mobile devices, and everybody could have their own little headset and they could dictate their own note. So it just depends upon the environment that you want to do it in. If you want to be walking around with it, as I say, you have to use multiple devices because trying to share a device will be difficult. Anyone else? No? Okay. Thank you very much.